my water just broke. I felt like things really intensified.
She was right there and she was coming.
It was an amazing feeling.
I'm going to cry just thinking about it. I could feel her head.
We heard her cry. We were squeezing hands and she was screaming.
I'm Bryn Hunt Palmer, and you're listening to The Birth Hour. This podcast is designed as a safe place to come together and share childbirth stories. Stick around and join us to hear informative and empowering birth journeys from all over the world. Today's episode is sponsored by Ergobaby. Founded in 2003, Ergobaby has pioneered the gold standard for comfortable, ergonomic, soft-structured carriers. Their commitment to providing parents with the foundation to thrive has launched the company into creating a broad range of award-winning products that fit into families' daily lives seamlessly, comfortably, and safely, where function and quality are not compromised. In 2020, they launched Everlove by Ergobaby, a first-of-its-kind baby carrier buyback and resale program, a sustainability effort to support families and the planet. At the end of this episode, I'm talking to Brandy from Ergobaby all about their new fabric they're using on their Embrace carrier, which is a really great carrier to use during the early days during your postpartum period. As many of you know, and many have taken advantage of, we have an online childbirth course offered for Birth Hour listeners. It's called Know Your Options, and I partnered with a lactation counselor, doula, and childbirth educator to bring you an evidence-based, fully comprehensive course. When you sign up, you get lifetime access and instant access, so you can go at your own pace, but also join in on our bi-weekly Zoom calls if you want to connect and ask any questions. Along with that, you'll also get access to a private Facebook group where you can get to know other students and ask our instructor and me anything that comes up for you while you're making your way through the course. As an added bonus, the course comes with a bonus course that's called Beyond the First Latch. This bonus course, which is also available individually for purchase but comes for free with the Know Your Options course, covers all things pumping, nursing, feeding your baby, storing milk, all the things you need to know for getting baby fed. Over the past year, we've been working really hard to update this course and make sure everything is up to date as far as evidence-based information. We also added closed captioning to all of the modules, and we've made it inclusive for everyone to take. So find out more about this course at thebirthhour.com/course, and we would love to have you join us. Another way to connect with the Birth Hour community is through our Patreon group. If you go to patreon.com/birthhour, you can see different levels to pledge your support to the Birth Hour. This helps support the podcast, and in return, you get fun perks like membership in our private Facebook group and access to all of our archived episodes, which at this point is over 500 more birth stories than are in your feed right now. So if you're new to the Birth Hour and you want to catch up on all the old content, please head over there and take advantage of that. We also have a backlog of expert interviews, and if you pledge at the co-producer level, you'll get access to our backlog of partner podcast episodes where my husband interviews partners about their experience with pregnancy, birth, and postpartum. Today's episode is part of our postpartum series in partnership with Ergobaby. In these episodes, we have guests share a little bit about their pregnancy and birth, but then the main focus is really on their postpartum period. So today's guest is Amanda, and she's going to be sharing 2 different postpartum experiences with us. She touches on emergency cesarean as well as her experience with a NICU stay for her baby. All right, let's hear from Amanda. Hi, Amanda. Welcome to the Birth Hour. Thanks for coming on the podcast today.
Hi, Bryn.
Can you start by telling listeners a little bit about you and your family?
Yes, I live near Denver, Colorado. I live with my husband, Jonathan. We have 2 kids, Rowan, who is 2.5 years old, and Aria, who is almost 9 months.
All right. And this is one of our postpartum episodes, so we're going to be mostly focusing on that. And it sounds like you have more to share about your more recent postpartum. But before we get to that, can you start by telling us just a little bit about your first birth and postpartum experience?
Yeah, so my first pregnancy with Rowan, the pregnancy was fairly easy. I was hoping for a low intervention birth. I was pretty open to, pain meds if I needed it. You don't ever really know what to expect that first time. So my water broke at 40 weeks and 3 days, and contractions weren't really starting on their own. I was GBS positive, so we went into the hospital pretty early. Immediately after getting there, I was hooked up to all of the things. So it kind of felt like things took a turn pretty quickly in a direction that I hadn't really wanted. So Rowan was having some heart decels, and They placed me on IV. I was on oxygen, the constant fetal monitoring, pretty much from the get-go as soon as we got there, fairly early in the morning. So I got there around maybe like 2 a.m. It was one of those middle of the night labors. So they checked me for the first time pretty early in the morning and told me that cervix was hard as plastic and was continuing to have those heart decels. So they did an amnio infusion, which is they just placed some kind of catheter into my uterus to replace some of the fluid that had been lost after my water breaking. It was supposed to help kind of provide him with a little extra cushion to see if he would handle labor better. And then they also started me on some Pitocin. But every time things would start to pick up, he wouldn't handle it well. They'd have to turn it back down. And I never made it past 3 centimeters. So after I'd already hit 3 centimeters, had a walking epidural, which was really nice. For anybody that hasn't had a walking epidural, I know not all hospitals offer it, but it kind of gave a little bit of pain relief. And then after like 30 minutes, you can get up and move again. But eventually went with a full epidural because I just couldn't cope with the Pitocin contractions. So they waited 5 more hours, did another check, still stuck at a 3. Due to the heart decels, they finally called a C-section after about 20 hours of labor. The C-section was fine. I felt, luckily, like I listened to your podcast a lot. So I felt informed. I felt comfortable with what was happening. I felt like I was in a good place with my doctor. I really liked her. But I think for a lot of people, it's not how you expect your birth to go. And I didn't really feel that immediate bonding with my son. So he came out, he was great. So everything went well. They placed him on my chest. And I just remember I was shaking a lot, really uncomfortable. I was exhausted from a long labor. And it just wasn't how you expect, I think, to meet your first baby. But it was textbook. And we went into recovery room and I was able to be with my son right away. Immediately, I go into this room to recover from this big abdominal surgery. I was shaking. I didn't feel well. And then they're like, oh, here's your baby. Start breastfeeding. And I kind of feel like that was the start of like this postpartum tone for, having my first child. And you feel like you're just kind of thrown into it and you never really get the time to heal yourself. So that seems to be the start of that journey in my postpartum experience. So tried to start breastfeeding in the hospital, but it didn't really go well for us. And I had bloody nipples from the get-go. I just didn't really seem to be getting it very well. I think it's tricky for a lot of people, but one of those things that you hear so often is that breastfeeding is a lot harder than you think it's going to be. It definitely was for me. But in the hospital, I think the other piece that I wanted to touch on there and like the immediate postpartum with my first was also feeling very sick. Like I was post-surgery vomiting. I was in a lot of pain, dealing with the exhaustion, and then trying to deal with taking care of this newborn and learn how to breastfeed and learn how to parent all at the same time. And to me, that was very overwhelming. And I don't think I was really prepared for that. So we, from there, went home after a few days, like pretty textbook C-section recovery in the hospital. And I just remember feeling the first night that we had our son at home and, he's waking up in the middle of the night and having this feeling of, oh my gosh, like, what have we done? What is my life going to be like now? And that was also, I think, really overwhelming for me. So for me, I often look back and I think going from 0 to 1 was just such a big mental shift for me that eventually, you kind of ease into it, but it, felt very overwhelming for me at first. The breastfeeding didn't really go well at all. We were probably supplementing with formula probably within the first week. I just didn't really seem to be producing much milk, and it's really hard to tell. I had worked with lactation in the hospital, but I didn't have any additional resources set up. So one thing that I always encourage new parents to do is try to get those resources ahead of time, like contact a lactation consultant ahead of time, look for therapists or whatever you need to do, because sometimes when you're stuck in the middle of the postpartum hormones and things aren't going well, it's really hard to reach out to get the help that you need. At least it was for me. So I did finally, probably like 2 months postpartum, started to feel like I was building my network of people. I was going to a mom's group and getting out of the house more, feeling more comfortable. Definitely realized we did like our first weighted feed at maybe like 6 weeks postpartum, and realized that he really wasn't getting much milk from me at all, which of course I felt horrible about. Started to work with lactation, but I never really had it in me to try to do the triple feeding. Like I would attempt to pump and attempt to feed, and kind of landed in a place of like, okay, well, I'll just try to breastfeed him and then give him formula to top him off. So we were able to still have a little bit of a breastfeeding journey. Probably around 8 weeks, we finally got his tie revised. So I wish I would have had that evaluated earlier. By the time that we had it revised, I didn't really feel like we were pretty much at the end of our journey already. Like my supply was pretty much gone. And that was kind of the end of it. But I'm glad we got it revised. He had a lot of trouble as well with like tummy time and like neck mobility and really being able to like lift himself. And so I think having that revision probably helped him in a lot of other ways other than breastfeeding. So I'm glad we did it, but that kind of felt like the end of our breastfeeding journey, because once he did get it revised, he just was not interested anymore, and it wasn't worth it to me to try to fight it, knowing that I had such a low supply anyways.
Yeah.
So I feel like that really covers like the immediate postpartum with my son, those first 3 months. For me, I am a working mom, and so I went back to work at 12 weeks postpartum. And that I feel like is really when I came into myself again, like when I started to feel it brought some normalcy back into my life. And I think I had been lacking in that in the first 3 months. I was just so afraid of going out of the house. I was afraid of like being in a store and having a crying baby, or, the viruses that are floating around. And this was all pre-COVID, but it just struggled, I think, a little bit. I don't think I had postpartum depression, but I definitely struggled emotionally with who am I now and defining myself as a mother, but also still being all of these other things like a wife and, somebody that, and the workplace, and how do I fit into this working mom role? And I think it just takes a lot of navigation and, self-discovery and patience. And so I learned a lot with him and how to really like find patience, be compassionate with myself, and know that like it doesn't feel normal now, but you're going to find a new normal.
Yeah. I've heard that a lot recently especially with these postpartum stories about going back to work being kind of a turning point. And I love hearing that, because I think we a lot of times hear the message of, how people dread going back to work. It's so terrible, but it's so different for everyone. And so thanks for sharing that.
Yeah. I mean, it was definitely a struggle going back to work and trying to find that new routine as well. So it was nice because I could get out of the house and talk about things that weren't my baby again. It also took time for my husband and I to figure out, our morning routine, who feeds the baby, when do you take a shower, when do you wash your hair, when do you make dinner? And so all of that, once again, it's something that you have to relearn, because you kind of get used to one way of life before you have kids, and then it all gets flipped upside down. But you figure it out as you go.
Yep, you have to, right? All right, so that's your first baby. Let's talk a little bit about your second and whether you planned anything differently for the birth or what that looked like.
So when I had my C-section with Rowan, it's so funny, like my husband knows me well enough. He actually asked the doctor before she even did the surgery, will she be able to have a VBAC? Like he already knew that I would be going for that. So I knew from the get-go that I wanted to have a VBAC experience. This might make more sense as I get further into the story, but I definitely put a lot of weight into it. I wanted that experience so badly, to have that vaginal birth, to be able to pull my baby to my chest. I thought maybe if I had that experience, that maybe I would be able to bond faster with my baby. After my first, it felt like it took a long time for me to be able to bond with him. So that was kind of my big reasoning for wanting a VBAC so badly. I did all the things that people talk about and tried to set myself up for success. I saw a chiropractor regularly. I went for acupuncture. I did the spinning babies movements, trying to make sure that she was in the best position. I ate a ton of dates. I will probably never eat a date ever again in my life. So yeah, I've worked hard. I figured, if these things work, great. But if they don't, there's not much of a loss there. So I'll just try to do them all. I went into labor at 41 weeks. So I had another relatively easy pregnancy. So that part was great. No big complications. And so at 41 weeks, I started labor in the middle of the night with contractions. So labor started different than it did the first time. And I was so relieved because I was just worried I was going to have another repeat water break, no contractions. And so I was so excited when I started contracting on my own. It felt like such a big deal. And I labored at home for about 20 hours. The contractions were they stayed like 5 to 10 minutes apart for those 20 hours. And they were lasting anywhere from like 30 seconds to a minute. But I could tell that it just wasn't consistent or like picking up. So it felt like they were painful, but they didn't seem to be progressing. And I just had this feeling. I was like, I don't think I'm progressing at all. But after that amount of time and being exhausted, and my sister was here to watch my son, we went ahead and called my doctor first and asked if I go to the hospital, will you guys send me away? Because I don't want that to happen. I was supposed to be induced the very next day. So they said, come on in, we won't send you away. So we made the trip. And sure enough, whenever I got there, I was only 1 centimeter, but I was 100% effaced, which she said was really unusual. And that if we could just try to get my daughter to descend, that I would be able to dilate pretty quickly. So tried, sitting on the ball, doing some other things. And then within like a few hours, I think I decided, I was like, this is just too much. I think I want an epidural. I just want to go to sleep. She said, let's check you. And then you can decide after that. So she checked me and I was 5 to 6 centimeters and my water broke at that point in time. So that was enough to get me excited, where I had this new burst of energy. And I'm like, no, I can do this time. Let's keep going without the epidural. So I called my doula. She was also my photographer and videographer, and she was really great. So she showed up and continued to labor. And I had the labor experience that I'd really wanted with my first. And I was walking around the room. I wasn't hooked to a million things. And, I was able to get into the tub. I was able to just labor in any position that I wanted. I was at a hospital, but I had a really great support team. So I actually looked around for like the best VBAC provider in the Denver area and felt like I was really at the best place. So that made a huge difference, I think, in my overall experience. I did decide to get an epidural around 7 centimeters. I think I was starting transition and got into that mindset of, why am I even trying to do this without pain medication? So went ahead and got the epidural. Took them a while to get there, and then it also took a while for the epidural to take effect. It just wasn't working very well, but eventually it did. And I went to sleep, got a little bit of rest, and finally got to 10 centimeters. So I had started labor at 1 a.m. on July 3rd. And I think I was 10 centimeters dilated by probably 9 a.m. the next day. So it was a long process, but I got there. So I started pushing. So we gave her time to kind of work her way down. They didn't rush me at all. I never did feel that big urge to push. But I thought maybe because I had the epidural, I just wasn't sure if that was going to come. But they wanted to start doing some practice pushes and seeing what we could do to get her out and down. So, and I was just so excited. I remember feeling like, oh, my body actually worked and I've made it to this point. And it just felt like such a huge accomplishment. But after 1 hour of pushing, I felt a big pop. And the birth team, my doula, my husband, and the nurse that was with me noticed, like they saw the pop in my belly and almost thought like she had kicked or did something. But I knew it didn't feel normal. And the nurse started to lose my daughter's heart rate. I was experiencing a lot of pain. And then that turned into nausea. So pretty quickly, I think I actually said to my nurse and asked her, I'm like, did my uterus rupture? Not in that tone. I was kind of panicking a little bit. She called in for backup pretty quickly, and probably within seconds, there was a whole team of people, including my doctor, in the room. And then it's hard to like tell the timeline, but I know also very quickly the doctor called a C-section. So they wheeled me down to the operating room very quickly. I started vomiting in that time. I remember, I think they turned me on my left side and I was just sitting in bed. Like there was no time to even grab a bag for me to throw up in or anything. And they're just rushing down the hallway, get inside the operating room, and very quickly they tried to get my epidural to work, but couldn't get it to work fast enough. And so they put me under general anesthesia. That's a lot of information for birth, but that's kind of the fast version. I woke up hours later, I'm assuming. I don't actually know how long it took, but woke up several hours later in the recovery room. My doula was in the room at the time. I quickly learned that my daughter was alive. I also learned that I still had a uterus. And just to confirm, like my uterus had ruptured. So that was kind of the start point of this new postpartum journey, which was vastly different, of course, from my first.
Yeah. How much do you remember from those, postpartum days in the hospital? I know sometimes coming out of general, it can all be kind of a fog.
Mm-hmm. I feel like I remember a lot. I mean, there's a good chance that maybe there might be things that are mixed up, but I also think that I was in like a state of shock. And I think the way that I handled everything was I kind of just cut off this emotional piece and got into this zone of, okay, what needs to be done? Like, how do we fix this? What do we do? How do we give like the best care for our daughter? And not to say that I wasn't emotional, because I mean, there were definitely a lot of moments of tears, but I was also, in this just kind of, I don't know, maybe like a little outside of myself of like, okay, how do we work through this now? And what do we do next? Yeah. So when I was in the recovery room, my husband came in pretty quickly, and I learned that my daughter had been, I think the doctor probably talked to me first. And so she told me that my daughter and the placenta had been free floating in my abdomen. So they had completely exited the uterus, and they exited, luckily for me, it was just over my prior scar, and there wasn't any additional tearing or bleeding. So that was positive for me, hence the reason why they were able to repair my uterus, kind of like I just had a normal C-section. But because my daughter was born, so she was unresponsive at birth, they were able to resuscitate her. But she had, a period of time where she wasn't receiving any oxygen. So one of the treatments that they recommend for that is to put them under cooling, like they cool their bodies for 72 hours. And so this is supposed to help stop any further brain damage. So there's like a chance that like you can't really reverse any brain damage if any brain damage occurred, but it would help stop the spread of any further issues. So my husband made that call while I was still under, that we were going to go ahead and go forward with that treatment to have her cooled for 72 hours. So she was, taken right away into the NICU, which is where my husband was whenever I woke up. And then he came back to come see me and tell me, everything that he could about what had happened and what was going to happen. So she was already in the NICU whenever I woke up. So I didn't get to see her right away. He showed me a picture. I think I sent you one of those pictures of me seeing her for the first time on the phone.
Yeah, we'll put that on the show notes.
Yeah, I have a lot of, because my doula was also my photographer, she just captured so many of those moments, which is, I think maybe for some might be triggering. For me, it felt really healing to be able to look back and kind of piece together like these steps that happen that, like you said, like when you're coming out of general, you're a little bit foggy. You may not remember everything, but I had this like visual to go back to, which was really neat. So she was in this cooling treatment. I went back to, after a little bit of time in recovery, they wheeled me into the postpartum area where I continued to hang out for a while they were basically waiting for all of the medicine to wear off so that I can move and be on my feet and transition to a wheelchair to be able to go see my daughter for the first time. So we waited that out for several hours, and of course, just monitoring any kind of post-surgery health issues that there could be. But I think after a few hours, because she was born at 11:05 a.m., and I think it was probably about like 5 or 6 p.m., I was able to go see her. So they worked really hard to, once again, like great, supportive, like wonderful doctors and nurses who worked hard to make sure I was okay and to get in a good place where I could be wheeled down to the NICU to go meet my daughter. So I really appreciate that they were willing to make that happen and to work with me, because I mean, they know how important it is, and you're just so excited to see your baby for the first time. So I did get to go see her, which of course was super emotional, because that's also not the way that you hope to meet your baby. She was intubated. She's sitting in this little like cooling pad that was cooling her whole body, and she had tubes in her belly button, through her like umbilical cord. She was hooked up. They were monitoring brain activity. So she had all of these pads like on her head, and it was wrapped around her head. So I couldn't really see like her hair or anything like that. So yeah, just tons of tubes and cords and things going on. So it was incredibly emotional to see your baby like that. And I knew from the get-go that I was probably going to need therapy. So I think that's like a good point to throw out too, that on that very first day, probably, I think before I even met my daughter, I reached out to a local moms group and asked them if they knew any birth trauma therapists. And I was super proactive on that because I knew it would just be a lot to work through. So would encourage therapy really for anybody. Therapy can be a great thing, but especially healing from birth trauma. So from there, it was just a matter of her waiting to see what was going to happen with her. Like, you don't know at that point, was there brain damage? Like, we're not sure either way. And also just recovering from surgery. So I stayed in the postpartum ward. She was in the NICU. I'm really fortunate that where we delivered was one of the best NICUs in our region. So I was able to just get up, like as soon as I could, I started walking down to see her. My husband initially probably like wheeled me down there for the first day, but I'm pretty sure that like within 24 hours, I was like up and walking to the NICU on my own. It's like a 5-minute walk, but of course, post-surgery, that feels like a lot. And so I would just go visit her during her care times. And then from there, I just I spent a lot of time pumping. So I guess that's a good start of the breastfeeding journey that really ended up not being a breastfeeding journey. But I was doing everything I could to pump, to bring in milk. I had no idea if it would be different from my first experience, but I, did a lot of research. I'd reached out to the lactation ahead of time. I thought, this time the breastfeeding journey is going to be different. I have the right resources, but of course, things never go as planned. So I did start pumping with the hospital grade pump and doing everything I could to bring in my milk. So I was pumping like every 2 to 3 hours, waking up during the night to continue pumping. And I would save any kind of colostrum that I was collecting. My baby couldn't have any right away, but after I think a few days, we were able to start giving her some. So I was saving everything I could and then walking it down to the NICU and just working as hard as I could to bring that in while I was just recovering and waiting for the first 72 hours. So the waiting part was really hard because you're just not sure what's going to happen. So that was challenging in itself. There's kind of two different things that happened. I guess there's like my daughter's NICU journey and how I navigated that. The other thing that I want to bring up is really care for myself and my own recovery. So was set to go home on probably like day 5. They let me stay 4 nights, which is pretty much the max they can push it out to that insurance will cover. So pushed out to the max. Day 5 rolls around and I started feeling a lot of pain in my chest. To anybody who's ever had abdominal surgery and possibly other surgeries, there's always a lot for me. Like I've struggled with like the gas that you get. It kind of like builds up in your belly. It feels incredibly uncomfortable. And so I thought maybe like this was like a gas related thing because they said sometimes you can like feel it in your shoulder. And so So I started feeling this like chest pain, and I just wasn't sure what was going on because I had been healing very well. And I was, like I said, up walking to the NICU every day. I was feeling pretty good. And then all of a sudden I had this like setback and this extra pain. So they ordered a CT scan and they found a blood clot in my lung. So just another thing where you feel like, oh, I was the 1% with this uterine rupture, and now I also have a blood clot. Was a pretty horrible feeling, but they started to treat me on blood thinners right away. The pain was a lot. So by that point, my husband was home staying with my son, and I had to ask him to come back because I just could not handle like the pain from my surgery and then this pain I was experiencing from this blood clot. All just seemed to kind of like hit. And physically, I just felt like I had taken like 10 steps backwards. It was really struggling to get through that. I was also incredibly emotional because I thought I was going to go home and be able to see my toddler. So, of course, this whole time I'm away from my toddler, and he wasn't allowed to be in the hospital because this is July 2021, and they really weren't, COVID. Some COVID restrictions still applied. The nurses were great, though. They actually had told me if my husband wanted to bring my toddler out, I would be able to go visit him outside. And they wheeled me out to go spend an hour outside, just spending time with my toddler. And I will forever remember that. And just like once again, where I can't say enough of like good things about the team that I had through this entire experience. So that was really amazing. But my husband did come back to the hospital one night because it was just unbearable. And I remember I was still trying this whole time to continue pumping, even just to like put on a pumping bra, like was so uncomfortable. I kept trying to take it on and off. And, at this point now I'm like hooked to all these new cords again. And it was just very frustrating. But I think after like 48 hours, I felt a lot better. It ended up being really like that. The pain from the blood clot didn't last a long time, but I also had some coughing. So I would just, caution anyone who ever has any kind of chest pain and coughing going on postpartum, especially after you've had a surgery, definitely get it looked at. Don't take it lightly and get that checked out. So I'm really glad I was still in the hospital and able to get the care I needed to be able to take care of that. But yeah, continue to try to pump. I really wasn't bringing in any, it just didn't seem to be progressing much. I was just getting little bits at a time. I'm like, okay, I feel like my milk should be here by now if I'm going to get milk, but it just really wasn't coming in. But I continued to go every 2 to 3 hours and just bringing down these little tubes of milk down to my daughter. So we just kept working through that. But then going back to her journey in the NICU, after her cooling treatment, they did an MRI. It takes a while. It's a process to warm them back up. So they warm the baby back up and then make sure that she's stable. And then they did an MRI for her, and they did find that she didn't have any noticeable brain damage. So that was, of course, the best news that we could expect to receive. I did want to mention as well, I think when she was still under the cooling treatment around day 2 or 3, they tried to move her to a CPAP. And I probably will not explain this very well, but I know she had inhaled some fluid during the birth process. There was also meconium. And when they put her on the CPAP, it caused, like I said, probably won't describe it very well, but ultimately, it ended up her lung collapsed and her heart stopped. They had to do chest compressions and then give her a dose of epinephrine to get her heart going again. I am incredibly grateful that I was not there in the room when that happened, because I think that probably would have been the most traumatizing experience of the whole thing. But she stabilized. They put her back on the ventilator. And so once they rewarmed her, I think she was still intubated at the time when they did the MRI. They thought initially that maybe she had had some kind of seizure, but then realized that it was probably a cardiac episode versus a, something from neuro. So she is the little fighter. I think around day 5 or 6, able to hold her for the first time. So they had to make sure that she was receiving enough milk orally to be able to take these tubes out of her belly that had been providing her with nutrition. And so when those tubes were attached, they told us like we wouldn't be able to hold her. But as soon as those came out, they said we'd be able to hold her. So once she started taking milk on her own, then we were able to hold her for the first time, which was, of course, the best moment, as I'm sure any parent can imagine. And then from there, she just took this incredible turn for the better, where, she came off the tubes and pretty quickly went through the CPAP and then put her on high flow oxygen, and then were able to move her down to low flow, and then started testing her on regular room oxygen. And by day 9, she came home. So it felt like one of those things that took forever, especially those first few days where we just weren't sure what was going to happen. And is she going to have health challenges that carried forward that we'd have to deal with forever? Would she be okay? Would she not be okay? And so definitely a lot of anxiety around that. And I think any NICU parent that has gone through something like that, there's so many unknowns and you just never really know what's going to happen. We really had no idea she was going to come home either. They just called us one day and they're like, bring the car seat with you. So it was amazing that we were able to get her home so quickly.
Yeah, that's a lot to go through for sure.
Yeah.
Gosh. Okay, so once you were home, how was everything?
So we brought her home and it was really amazing, of course, to have that experience, to have your toddler meet the new baby for the first time.
Yeah.
I'm really happy that part, it started to feel normal, like a more normal experience of bringing your baby home. And so I'm really glad that we were able to have that adjustment, and he did great. So I think that's, a lot of people want to know, what's it like having 2 kids and going from 1 to 2? And I actually felt like that was a much easier adjustment for me to make. I think I just felt overall more confident and comfortable being a parent. And so it didn't feel like as big of a shift as going from 0 to 1. So really enjoyed that experience of coming home and trying to get into things. The other thing that really made a difference during this postpartum period is my mom came and stayed with me for 2 weeks. And it was just really nice to have that extra support. I thought with my first, I was like, I'm going to want to be alone during this time and bond with my baby. And during the second postpartum, I'm like, no, I want somebody to come help me with cooking and cleaning and keep me company. And so that was really positive to have her there. And I just think overall that made our transition so much better. I did continue to try pumping. I spent a lot of money trying to buy all the things to bring my milk in. I felt so committed to trying to make it happen. So I even ordered the hospital grade pump for my house. I rented one and I met with lactation. I was trying lactation foods. I was trying to make sure I had the right supplies, the right size flange, and was just working through everything I could to try to bring in my milk. It just never happened. And we did try to breastfeed as well, but she didn't really want to latch. And I felt like because I didn't have this supply, I didn't want to spend a lot of time trying to work on that if I didn't have any supply. I didn't want to spend time trying to bring her to breast if I knew that nothing was really going to be coming out. And so I was really trying so hard just to get some kind of supply going, but it just didn't, it never did come. So I eventually let go of the pumping after about a month because combined out of both sides, I was lucky to get maybe 1 ounce or maybe got up to 2, 1 to 2 ounces out of both sides combined. It just wasn't really sustainable to try to keep doing that much and getting so little. So I did finally make that call about a month postpartum, which really just I felt like both times when I let it go, it just felt a lot better. It was kind of freed me to be able to say okay, I don't need to feel bad about this anymore. I don't, every time I would pump and then I'd feel negative and be oh, I didn't really get anything this time. And it was just so frustrating to try to deal with that. And so for me personally, kind of ending that experience and being able to move on just was overall very positive. So I'm glad that I made that call early enough and just kind of said, okay, let's just move on with something else. So yeah, I don't know if I'll ever know why I don't really have any breast milk supply, but it just seems to be I don't know if that's just my body or if there's something else I could have done, but, I feel like I tried as much as I possibly could. So that was definitely a hard part, but I have 2 mostly formula fed kids and they're great. So
yeah. Yeah, I think that it's important to add to the discussion about nursing that, the mother's well-being and mental health, physical comfort, all of that stuff matters.
Yeah, definitely does.
All right. Anything else from your postpartum?
I'll just add quickly, I had to continue to treatment of my blood clot. I had to continue to give myself injections for several weeks, which was not fun. And while we were trying to get my medication right. So that was also a challenging piece. I had never had to give myself injections before, but not a fun thing to go through. And then the only other piece I want to add is just around physical healing. This postpartum for me was post-surgery. I would just say overall, it caused more physical pain for me. The surgery was described to me as being fairly intense. She was kind of stuck up in there, and they said they had to do a lot of pushing and pulling and tugging. So I definitely had some issues with pain postpartum. And I felt like with my first, it was I had to take pain medication for 1 week. And with my second, it lasted for 3 weeks. But once again, give a lot of credit to my doctor and my support team. My doctor was available to me via text message, and he just reached out so often and making sure that I was okay physically, emotionally. And I think that really changed my experience to have this supportive team during such a difficult birth and postpartum experience. But when you have the right support, I think it can just change things where, it goes from being very traumatic to feeling okay, I have the tools that I need to be able to handle this, and same thing with also finding the therapy support, which I'm still going to now, and has been really positive, just helping me deal with anxiety and guilt. I definitely had a lot of guilt I was working through and still working through some, fears and anxiety that I think come with having a traumatic birth. So just would encourage other people to definitely reach out to find that network of people, because I just think it makes a really big difference.
Yeah. Yeah. That just made me tear up listening to you talk about your doctor. And it should be the norm. It shouldn't be something that's this wonderful outlier, but I'm so glad you had that support.
Yeah. I can't say enough good things. And I'm going to tell him, I'll probably even send him a text message and say, hey, I have this podcast, go listen to it.
Good.
But yeah, he was just incredible. So
awesome. All right. Well, any resources you want to share?
I feel like most of my resources came from the Birth Hour podcast and Facebook group. I also listened to the VBAC link a lot and was part of their Facebook group. And I think it was a really great resource. But I also feel like I got stuck in this huge mindset of I have to have a VBAC, And so it's a lot of great information. And I'm glad that I learned all of the things that I did through that group, but also felt then I kind of got stuck in this VBAC mindset. I'm glad I had the labor experience I had. I'm glad I tried. I think I would have always wondered had I not tried. I'm obviously not glad with the outcome. So I still would, of course, encourage people to try to just go for the birth that you want to go for, because I think that's really important. And an evidence-based birth. I also anytime I was oh, should I try this chiropractic care? Should I eat these dates? And I think the evidence-based birth website is really great.
All right. Well, we'll put all those in the show notes. And then where's the best place for people to reach out to you?
I am more active on Facebook, just under Amanda Jamison, and then also on Instagram at Amanda_moves.
All right. Well, thank you so much for sharing today. It was so great to hear these stories.
Yeah, thank you, Bren.
All right, now I'm going to talk to Brandy about Ergobaby and their new fabric for their Embrace newborn carrier. Hi, Brandy. Welcome to the Birth Hour. Thank you so much for coming on the podcast today to talk with me about Ergobaby.
Thank you for having me. I'm super excited to be here.
All right, so we're going to be talking all about postpartum and some of the carriers that are really great for that time period. But before we get to that discussion, can you tell people just a little bit about you?
Yeah, my name is Brandy Sellers-Jackson. I am a birth and postpartum doula. I'm a writer, and I am the social media momager here at Ergobaby.
All right. So postpartum is a topic that comes up a lot on this podcast. And I know also with Ergobaby and your social media and everything. So what are some of the biggest challenges with that time period that we're dealing with?
Besides everything.
Exactly.
This is a big one. Besides everything, you're hot. You feel like you're all over the place. You feel a lot. You are getting back into your body, and not in the sense of like the weird snapback thing that's going around, but more so feeling at home in your body. You have a new, a baby. And even if it's your first, second, third, or fourth, it's still a new baby. And there's a learning curve that's happening. And it's a lot to keep up with. It's a lot. And it's just a weird time. I've talked about this before, recently, but it's weird. And if more people really just accepted that it's just a weird, weird time, then the better off everything would be.
Yeah, I agree with that. And I think it's really hard to accept that until you've been in it because it's hard to, like you said, it's hard to really fully explain or wrap your head around. And so I know for myself and people I talk to as well, like their second or third babies, it's a very different experience because you kind of can appreciate what you're about to really go through.
Yeah. It's just weird. You spend your entire pregnancy being inhabited by a little person, and then said little person comes out, and you're left with you and this new little person, and it's just this weird balance of all of it. And so it's just it is a great time. I will say this, a great opportunity to learn a lot of gentleness with yourself. And we hear that so much, it sounds so overplayed, to be honest, but really all the gentleness, and really looking at it as this is my moment to just really do whatever I really want to do. And if I don't want to do it, then not doing it, because it's just a weird time.
Yeah, I love that. And I totally agree. Okay, so obviously, like you said, we could talk about so many different things when it comes to postpartum because everything really changes. But we're here to talk about Ergobaby. So I do want to really focus on baby wearing and how you guys have made that, more accessible, especially in those first few weeks. I know when I had my first baby 10 years ago, I had an Ergobaby carrier, and it you had to get a separate infant insert, and it was all these things. But now you guys have really developed different products for different stages. So can you tell us a little bit about that?
Yeah, Ergobaby has come a long way. We are upon our 20th anniversary, I believe.
Oh my gosh.
And it's, we've seen so many variations of the original carrier. First, it was just the traditional classic carrier. And then that melded into these variations where, you had to have the infant insert. And then we went into the, adapt. And that one, you didn't need an infant insert. And then, you had a 360. And then you need an infant insert for that one. But, you could have it in all the different positions. So, and then it's gone from that to Heirloom, to Embrace, to Omni Breeze, Omni Dream, so many different carriers. And the thing that I love about Ergobaby is that we constantly strive to improve, but more so specifically, and I think most importantly, to make life easier for parents. Life is hard enough. Life is hard enough, especially these past 2 years that a lot of parents and people have been through. And baby wearing, caring for your children, if we can provide a little bit of respite and a little bit of just in the process, I think it's needed. So I love Ergobaby. We're constantly trying to make things easier. Yeah, I'm really proud of that.
I think that you guys do such a good job of connecting with your customers as well. Like, I'm obviously out in the baby world too, and I see Ergobaby set up at pretty much every type of baby event there is, and you're helping people, do fit checks and try on and see what's most comfortable. And so I know that when you're developing new products, it's because you're doing it for your customers that you've talked to.
Absolutely. I that's what attracted me so much to, even coming on board with Ergobaby was just, the heart behind it. that we want to see parents succeed and to feel seen, and then also to feel like humans again, which is also why I love baby wearing. It allows parents, new parents, and by new parents, I mean new parents, but new parents to feel like humans again. When you're constantly holding a baby, when you're constantly caring for a baby, when you're constantly just at the will of a baby where you can't even go pee, you begin to feel, or to take care of your basic needs, like a shower, you begin to feel like you're not a human anymore. And so it's really amazing. It allows people to connect with themselves and to say, okay, I can do more things than just sit here and hold this baby.
Yeah. I'm just like nodding along while you're talking, taking me back a few years to being in it. Okay, so let's talk about the Embrace newborn carrier and the new fabric option that you guys have just launched.
Yes, so we are launching the Embrace Soft Air Mesh, and we're super excited about it because it is like the best of both worlds. With the Embrace carrier, it's like a mesh between the classic soft structured carrier, but then a traditional wrap. So you have the snuggling of the wrap, but you don't have all the wrapping that you have to do with the wrap and all the tricks you got to do with the wrap. You can just cross and then click, 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 into the buckles, and boom, you're done. Again, making life easier for parents. So I love that. But then with the soft air mesh, this new carrier, we changed the fabric a bit. So, with the previous Embrace, we had just a traditional fabric. This one has breathability. It has, airflow. It's mesh. So it's perfect for postpartum, which is why, we're all focusing on postpartum in this campaign, is because it's really, it's all about postpartum. It's with the soft air mesh. It allows folks to just not be hot, which is another thing that people feel so much during postpartum, is this constant feeling of like, oh my gosh, is it a sauna here? Oh my gosh. Oh, it's only 60 degrees. Why does it feel like it's 90?
Yeah.
The soft air mesh is great for that. Allows breathability, airflow, and it'll keep you kind of cool and dry and not feeling so hot. Like, who wants to feel that? No one wants to feel that.
It's so true. Even in the colder months, you're just so much hotter when you're postpartum and you wake up in sweats. And I guess maybe it's like preparing you for menopause or something, but it's unbelievable how hot you get. And with the summer coming up, it's even more so of a concern. And that was kind of my main issue with baby wearing, was living in Texas and not having options that would not just... You're not even just worried about yourself, but you don't want your baby to get too overheated.
Oh my gosh, absolutely. No, that part. It's funny. For all of my babies, I had to think about it. I was either pregnant in the summer. Yeah, I was pregnant every summer, actually, now that I think about it, with every single one of them. With my middle I was pregnant through the summer. He's born in August. But my two fall babies, the entire summer. And I remember with my middle giving birth to him in August during a heat wave. And I would have loved to have this carrier, the soft air mesh Embrace, because it was so hot. He and I were just skin to skinning it the entire time. And not because it was just, the benefits. No, because it was hot. It's really hot. It's hot. And I don't want to put on clothes. I can't.
Yeah.
So, it's
just sweating all over each other.
My gosh, so sweaty. Like everywhere is sweating, everywhere.
Yeah. Well, I love this carrier. I think that, like you mentioned, all the different wraps and things are beautiful and wonderful, but it can be a lot to figure out tying those, especially when you're healing. And I know for me, my husband was not a fan of those kinds. He was just anything I can do to get in a buckle carrier as soon as possible is what I want to do. So I think this is a great newborn carrier for everyone to use, regardless of, skill level and familiarity with baby wearing.
Absolutely. Absolutely. It's like, make it easy on yourselves.
Yes.
You get 0 prizes for it. And I've looked to see, do I get a prize for learning how to like do X, Y, and Z. No, I don't. Nothing. I get 0 for this.
So true. You get mental prizes for making things easier on yourself, for sure.
Your brain is freed to do other things, the things you actually want to do. Yeah, I love this carrier for that. It's super simple, super easy, and super breathable.
Wonderful. I can't wait to feel this new fabric. Everything that you guys do is amazing. And I'm just so happy, as always, to be sharing about a new product from Ergobaby. So thank you so much for chatting with me.
Thank you so much. As always, it's such a joy. Thank you so much.
Thank you so much again to Amanda for sharing her postpartum stories with us, and to Ergobaby for sponsoring this episode. You can get more information from today's episode by heading over to thebirthhour.com and searching for Amanda's name in the search bar to find her show notes page. Thanks so much for listening. If you enjoyed today's show, head to thebirthhour.com and click Become a Member to pledge your support. And as a thank you, you'll get an invitation to join our private Facebook group and access to exclusive episodes. Your vote of confidence and support means the world to me.